welcome you all in the module of Panchakarma. I am Dr. Rajkala Patil, Associate Professor and Head of the Department of Panchakarma, Faculty of Ayurveda, IMS BHU. In today's module, we will be discussing the Vamana in detail, and in this whole um, lecture, what is the class? We will clear, describe the matter regarding what is Vamana, what is the difference between Chardi and Vamana, what is the classical way of doing Vamana, what are the different types of Vamana, what are the classical indications of Vamana and what are the clinical indications of Vamana, what is the pre-operative of Vamana and what is the actual procedure of Vamana and what is the post-operative of Vamana. So, in nutshell, in today's lecture, we will discuss the whole ideally classical procedure of therapeutic emesis, that is called the Vamana in Ayurveda. So, the Vamana is Tatra dosha haranam urdhva bhagam Vamana sadhnakam. So, when the vitiated doshas are expelled through the upper root or mouth is called the Vamana. And the scope of Vamana is mostly Panchakarma is having three major aspects, that is preventive, curative and promotive. In the same manner, Vamana also has the preventive aspect also. So, in Kaphaja diseases or in Vasanta Ritu, before every Rasayana procedure or Vajikarna procedure, when we plan a patient for the Rasayana or Vajikarna, before that, if there is the Kaphaja Roga or the season is Vasanta Ritu or spring, everybody should undergo the therapeutic emesis procedure, that is Vamana. And the curative aspect is, it is the very disease specific, such as skin diseases, asthma, diabetes, where the therapeutic emesis is a main treatment and it can be done in any Rutu also. Like it is written in Ashtanga Hridaya, like if there is no proper Vasant Rutu, so Sadharana Kale, we can make the Krutrim Gunopadhan and we can make a environment like Sadharana Rutu or Vasant Rutu and we can do the Vamana in such cases in emergency also. Acharya Sushruta also says like Chinna Taro Pushpa Phala Praroha Yatha Vinasham Sahasa Vrajanti Tatha Vrute Shleshmani Shodhanena Tat Vikara Prashanam Prayanti. When the root of a tree is cut, the flower, fruits and the branches are destroyed. In the same way, when the disease is originated by excess of kapha and it pacified after the whole disease is pacified after the elimination of kapha through Vamana. That's how, like in Panchakarma it has been written, like the diseases which are cured by Panchakarma will never recur or which will never come again. That's why the Shodhana is very, very important in many conditions of the disease. So here are the classification of Vamana. It is not a same procedure cannot be applicable for all the patients or for all the seasons or for all the diseases also, or the same disease if having in different persons, the same Vamana procedure we will modify it or we will personify it. So on the basis of that, the Vamana is classified into the following 5 subtypes, that is Sadhya Vamana. There is specific condition is explained in the text where we have to do the Sadhya Vamana. Then Sneha Purvak Vamana. In Sadhya Vamana, Ishat Sneha or Sneha is explained, like without doing Snehapana, we do the Vamana, that is Amavastha of Jvara. In Amavastha of Jvara, we do the classical text is having a reference for the Sadhya Vamana. And Sneha Purvak Vamana, what we usually do, we do the proper Dipana Pachana, Snehapana, then Gap Day or Abhyanga Svedana, and then we do the classical Vamana, that is Sneha Purvak Vamana. And this Vamana is again classified into the Mrudu Vamana for the Alpa Bala patient, Madhyam Vamana for the Madhyama Bala or Madhyam strength patient, and Tikshna Vamana for the strong patient or the disease where the doshas are vitiated at the peak or in the large form, then we go for the Tikshna Vamana. Then classical Vamana, like where we follow all the pre-operative till post-operative classical methods, that is the classical Vamana. And traditional Vamana, I think you might be aware of the one temple in South India where the pujari gives some medicine to all the patients in some kheer or in some payasam, and the patients whole day from 9 to 12 or 1 o'clock around, they will roam around the temple and they will vomit. That is the way of doing the traditional Vamana. There they won't follow the classical way of Panchakarma or Vamana, so that called the traditional Vamana. So these are the Vamana medicines which we mostly use. Okay, Madanaphala, as in text it is the whole method is explained how to prepare the Madanaphala pipali from the Madanaphala, when to collect the Madanaphala, that we will discuss in next lecture. So the medicines are Madanaphala, Dhamargava, very routinely we get Dhamargava for the Vamana, Kutaja and Nimba. So routine Vaman yoga, what usually we do, we add the Madanphala Pipali, Yashti Madhu and Vacha, rock salt, honey, and we use the milk for the Akantapana. So mostly what Vamana drugs are there, they have the Madanphala specifically, it has the saponin and it directly stimulates the CTZ chemoreceptor triggered zone, and it induces the Vamana or emesis process. Some drugs are Vamaka, some are Vamanopaga, like Madhuka Kovidar, Karbudar, Nipa Vidula, Bimbi Shanapushpi, Sada Pushpi, Pratyeka Pushpi. These all are the Vamanopaga drugs which helps in the Vamana procedure. In Charaka, it has explained the Mulini and Falini specific drugs which are used for the Vamana. So, what we need during Vamana or the yoga of Vamana, mostly we use the Madanphala Pipali Churna with honey. Sometimes if the patient is of Tamak Shwasa or asthma, we make the Dadhi of Madanphala or Pipali and then we use at a Vamana yoga. Sometimes we use Kshirapaka as a patient is of children or in the old age. If we want to do the Vamana, then we go for the Kshirapaka, and sometimes we use the Kashaya for as a Vamana yoga, or in a very delicate or Sukumar patient, we use the Greya yoga of Madanphala. So specific indications are Visheshena tu Vamayet Navajvara, Atisara, Adhapitta, Asruk, Rajakshma, Kushtha, Meha, Apachi, Granthi, Shlipad, Unmad, Kas, Shwas, Rullas, Visarpa, Stanya Dosh and Urdhvarog, or the diseases of upper respiratory tract or ENT disorders. Clinical conditions, whenever there is the Utklishta kapha is present in any disease, it might be a prameha, it might be kushtha, it might be vata shonita, it might be amavata. Whenever there is a Utklishta kapha is present in that disease condition or disease, that is the indication of Vamana. In first stage of Jvara is also, why the first stage of Jvara is indicated for Vamana, because in first stage of Jvara the doshas are vitiated in the Amashaya and it present in the Amashaya with Kapha Pradhanta and it is in the Utklishta Avastha and they are ready to come out. That is the ideal indication for the Vamana in Jvara. Then Rajakshma, which involves a complex pathology resulting in a multitude of symptoms, is also indicated for Vamana. Skin diseases like psoriasis, wet eczema, or lichen planus, these all are the indicated for the Vamana. Respiratory diseases like asthma, COPD, in such cases, or in ILD also, there is a condition whenever there is kapha predominance is there, Vamana is the indication. Certain psychological disorders like depression, schizophrenia, these all are the classical indications for the Vamana, and we are getting very good result after the Vamana also. In some depression patient, when we ask patient, yes, whatever causing you depression, it is coming out through the Vamana. After Vamana, the patient feels, yes, everything has come out and now I am free or I am healthy. So that is the feeling of well-being after Vamana a psychiatry patient get. Then Prameha, of course, the type 2 diabetes mellitus is indicated for the Vamana, not type 1, and the conditions like PCOD, PCOS is also indicated for Vamana. Of course, in Panchakarma, contraindication is most important part. Though the patient is indicated for Vamana and patient comes under contraindication, it is advised to not to do the Vamana, or we can do the Vamana in the mild form. So, the classical contraindications are avamya, those who should not undergo Vamana is Garbhini, of course from the first month till the 9 months, or after that also, if Sutika also for 1.5 months is contraindicated for the Vamana. Rukshaha, those who are having dry or more Vata Pradhanta in them, they are contraindicated. Shudito, those who are having more appetite or those who are having Bhasmak, or those who are getting properly more appetite, they are contraindicated for Vamana. Nitya Dukhitaha, those who are not happy or those who are not listen to anything, they are nervous or depressed or they are having negative approach, they are not able to do the or follow whole Vamana procedure. That's why these all people are the contraindicated for Vamana. In the same manner, Bal, children's, Vruddha, Krusha, Sthula or over obese or over emaciated, Rudrogi, the persons with heart disease, Kshata Durbala or those who are having Urakshata or consolidation in the lungs, Durbala, those who are having strength less, Prasakta, who are having nausea, Vamathu, those who are having Chardi, Pliha, Pliharog, Timira, Krimikoshtha. If yes, it is a condition when if patient is having Krimikoshtha, and if we plan the or if we do the Vamana in that, it is very difficult to manage that krimis coming in the vomitus, and counseling the patient is the worst part when a Panchakarma physician suffers a lot. That's why the Krimikoshti, if we come to know that there is a Krimikoshti, it is contraindication for the Vamana. Urdhva Prasakta Vayu, if the Vayu is about to come in the upward direction, that is contraindication. Datta Basti, those who already have taken the Basti, they are contraindicated. Hataswara, those who are having any paralysis of vocal or those who are having very less voice or pathologies of the voice, they are contraindicated for Vamana. Mutraghati, like failure, renal failure. Udari, that is ascitic patient. Gulmi, Durvamo. Durvamo means those who are not easily vomit. They are Durvamo. Atyagni, having more Agni, and Arshasa, those who are having piles. Udavarta, Brahma, Asthila. Asthila is prostate. Parshvarug, those who are having back pain. Vatrogina, those who are having predominance of Vata or Vataroga. Rute, females who are Rutimati. Visha, Gara, Ajirna, these all are the conditions where Vamana is contraindicated. So, clinical contraindication, of course, it is strictly, Vamana is strictly contraindicated in pregnancy, in children below 12 years, because they are not able to follow the instructions given by the Panchakarma physicians. Those children, I remember I have done the Vamana in 9 years of the 9 years children who were twins boys, but it was very difficult to convey them, like after taking Akantapana they have to take the Vamanaushadha, and after Vamanaushadha they have to take the Vamanopaga, because they will run in the theatre. That's why below 12 years it is advisable to avoid Vamana, and if it is very necessary or it is must or it is emergency, then convince patient before 10 days. Or in the old age also it is contraindicated in emaciated patients. In the patients those suffering from the cardiac problems, it may get the sudden cardiac arrest also. That's why it is contraindicated. In patients where gastroparesis, there is no reflex in the gastric region, they are also contraindicated for the Vamana. Coming to the procedure in detail, of course, the Sambhara Sangraha or collection of the material is the most important part in the Panchakarma. So, whatever we needed for Panchakarma, it should be collected and kept ready. That is called the Sambhara Sangraha. Atur Pariksha, of course, patient is suitable for Vamana or not. What are the complications we may get during Vamana, or what are the examinations we have to do? Sometimes ECG or echo or BP monitoring or the per rectal examination is very mandatory, or liver palpation also sometimes it's very mandatory. So these are all the examinations a physician, a Panchakarma physician should do before planning the Vamana. A plain chest X-ray also is mandatory to go do before Vamana. Matra Nirmana, Matra Nirnaya, of course, before planning the Panchakarma, the Agni and Koshta should be assessed. On the basis of Agni, Koshta, like Agni, Koshta, Rutu and Prakriti, the dose of the Vamaka drug should be decided. Otherwise, the whole procedure will be in the West. So, Atura Siddhata, first preparation of the patient, that includes the Vamana Purva Bhojana, that is the dietic regimen, Snehana and Svedana, that is oleation and sudation therapy, and Manasopchara. This is the most important part of Vamana, because we plan the patient for Vamana and patient don't know what is happening with him or what he has to do. So, before planning Panchakarma only, the Atur Siddhata is the most important part. Ask patient what are the procedures we are going to do with his body and what he has to follow with, because as we will see, like the diet at every stage is different in Vamana. During Dipana Pachana, the diet is different. It should be Laghu Ahara, Ushna, and it should be light diet. During Snehapana, it should not be so oily or heavy diet. During gap day, it should be the specific diet which patient should take. During the gap day, it should not be more kafara or more pittahara. On Utleshkara diet, there is a specific diet which should be given before Vamana day, that should having specific qualities to increase the kapha. So, at every stage, the diet is different in Vamana, that should be explained to the patient. So, the in Purva Karma of Vamana, first is the Dipana Pachana. Of course, we give some special diet, that is usually in Panchakarma, we ask patient to shift on the Mudgayusha or chapati with sabji or khichdi for the Dipana Pachana days, and specifically I always advise to take the chach or buttermilk during the Dipana Pachana days. And for Dipana Pachana also, we give specific drugs to increase the Agni and to increase the Dhatva also. And of course, the disease specification also should be keep into the consideration, that if there is a Tamaka Shwasa, we usually add the Shrishadi Kashaya during the Dipana Pachana. So, he should not get the status systematicus during Dipana Pachana. If the patient is of skin disease and we are planning for Vamana, we add the Manjishtadi Kashaya to avoid the severe itching during the Dipana Pachana. If the patient is of rheumatoid arthritis, we add the Rasna Sapta Kashaya during Dipana Pachana, which also do the Dipana Pachana and Roga Shamana also. Then coming to the this Dipana Pachana is, this is the proper assessment till what time we have to do the Dipana Pachana. As Dipana Pachana is proper, then only we will get the proper Snehapana, and if the Snehapana is proper, then only we will get the proper Vamana. So, these are, everything is interlinked. So, that is why it is very important to complete the first phase in a proper way. So, these are all the symptoms which we get after the proper Dipana Pachana or proper Rukshana. So, patient should feel the lightness in the body, he should feel that his appetite has been improved, he should feel the thirst, and well formed stool without mucus should be present, and the tongue examination should show the Niramavastha. This is the Purva Karma, Dipana Pachana of Vamana. Then Snehapana starts. After starting the Snehapana, there are the specific do's and don'ts patient should be followed during the Snehapana days. That might take 3 to 7 days, and he has to follow the Ushnodakopchari Sat Brahmachari Kshapashayaha Navegrodha Vyayama Krodha Shoka Bhayatapan. He should avoid from all these things. He should not sleep in the daytime. He should not indulge in the sex. He should not take the cold water for the drinking. He should not awake in the night time. These all are the do's and don'ts patient should follow during the Snehapana. And the choice of Sneha should also be specific according to the disease. If it is a Pitta Pradhan patient, we should go for the Dadimadhigrita. If we are doing Vamana for the hypercholesterolemia or obesity, we can go for the Tila Taila for the Snehapana. And if you want more specific result, we can go for the Triphala Taila. And of course, proper Snehapana Lakshana also should assess before stopping the Snehapana. That Adhasata Snehadarsanam should be there, or patient should get appetite on the last day after 12 hours of the ingestion of the Sneha. That is also very, very important. And then comes the gap day, that is one day we will do the whole body massage and fomentation. For again the Abhyanga or massage, the specific oil should be used according to the seasonal variation and according to the disease also. Then when previous day of Vamana, there is a specific diet that is called the Utleshkara Ahara, that again vary according to the desha or according to the season. Routinely Medu Vada or Dahi Vada or Shrikhanda is advised for the Utleshkara Ahara. Then material required for the Vamana: large basin or Vamana pit, medium size vessels, 2 steel glasses capacity of 250, or mostly this Punjabi lassi glass, that is 500 ml glass is better to convince the patient for the drinking all the liquids during the Vamana. So there should be 2 or 3 glasses should be there. Tablespoon 2, Khalvayantra 1, stool 1, chair with armrest 1, cotton cloth 2, hot water bath vessel 1, and stove. The medicines on the day of Vamana, usually what we prepare: Madanfal Pipali Churna 10 to 15 gram, Vacha Churna 5 gram, Yashti Madhu Churna 5 to 10 gram, honey quantity sufficient, and Sendhava 10 to 15 gram according to the cost of the patient. Of course, Mrudu Koshta will need less dose, Madhyama Koshta will need the Madhyama dose, and Kruru Koshta will need the more dose. And for the Vamanopaga or Akantapana, usually 4 to 6 liter milk we keep boiled and we keep it warm. Hot water for the Lavanodaka will be ready. Haridradi Varti for the Dhumapana after Vamana should be ready, and rock salt quantity sufficient should be there. Oil for Abhyanga should be present. So I like this quote from Ashtanga Hridaya, like every condition he has given what are the prerequisite for the Vamana, and in the very beautiful manner. Atha Sadharani Kali, that should be the Sadharana Kala. It should not be extreme heat or extreme cold. Atha Sadharani Kali, Snigdha Swinnam. The patient should undergo the Snehana and Svedana Yathavidhi properly. Shovamyam Utlishta Kafam. Previous day of Vamana, he should take the Utlishta Kafahar or Kafotlishta Ahar with what should be there? Matsya, Masha, Tiladibhi. Those who are non-vegetarian, they can take the fish. Those who are vegetarian, they can go for the Masha or Tila in the Utteshkara Ahara. Then on the day of Vamana, how the patient should be? Nisha Suptam. He should take proper sleep in the previous night. Sujirnannam. Previous what he has taken the Kafotleshkara Ahara, it should be digest properly. Sujirnannam. Purvanne, in the morning hours before sunrises. Krutamangalam, it is very, very important. Krutamangalam. In all the Panchakarmas, it is written like Krutamangal. Patient should pray before going to Shodhana. So Krutamangalam. Nirannam, he should be empty stomach, or Ishyata Snigdham Va, or he should take the peya pita sarpisham. He might take the peya with a small quantity of ghee. In whom you have to give this? That is vruddha, those who are old age, children, abal, who are having less strength, kleba, those who are having fear, roganurodhataha, according to the disease. In this condition only you have to take the yavagu or peyapan before vamana. Akanta paya madhyam kshiram ikshurasam samam. So after taking this, patient should give the akanta, should be advised to take the akantapana. What should be used for akantapana? Madhyam, kshiram, ikshurasam or rasam. So according to the condition, those who are used to madhya or those who are alcoholic or those who can take the alcohol, they can be given the alcohol for the akantapana. The person like females, those who are not used for the madhya, they can go for the kshira akantapana for the kids also. Ikshurasa, if ikshurasa is available, that should not be yantra nishpirita, it should be fresh. That is the ikshurasa, if it is available, that can be used. What we have seen with ikshurasa, if we use ikshurasa, because morning 5 o'clock we are not going to get the fresh ikshurasa, so we will collect previous day night ikshurasa, and if we give the ikshurasa for the akantapana, mostly patient starts the rakta chandrika or rakta chardi. That's why it is not advisable to take ikshurasa. If anybody get fresh ikshurasa, they can be used, or mamsarasam. Yatha vikar vihitan, according to the disease, madhu saindhava sayutam koshtam vibhajya bhashaj matram. According to the koshtha, using the madhu saindhava, the vamana matra should be given mantra abhimantritam. Without mantra, vamana aushadha should not be administered. Why the mantra? Because in this mantra only, the acharyas, they were knowing like only aushadha is not going to work. What is going to work is Brahma, Daksha, Ashwa, Indra, Rudra, Bhu, Chandra, Arka, Anila, Anala. These all are the things which are going to help in the success of Vamana. That's why they asked to first pray Aushadhi Grama, from where we get the medicines, we have to pray them also. Bhuta Sanghasha Pantuta. So this prayer itself says that for the success of Panchakarma, we need the everything in line, like whole geography, whole geography or meteorology should be in line, then only we will get the proper shodhana. As we start the Vamana and there is the Durdina, like sun will not raise or sun will be cloudy. Of course, the patient will get again and again Vega, or he may get the Kafotlesha more, or he may get the Kafa Vruddhi Lakshanas. That's why it is very important to pray first before Vamana. On the day of Vamana, what is the sequence of procedure we do? First, we do the Akantapana or Yavagopana. Already we discussed in the previous slide for whom we have to give the Akantapana directly or for whom we have to give the Yavagopana. Then we give the Aushadhi Sevana. That is what after prayer we give the Aushadhi Sevana. Then what we have to do? Pito Muhurtam Anupalayet Tanmana. After giving the Vamana Aushadha, we should wait for the one Muhurta. Patient should relax to start or initiate the Vamana Vega. If it starts, then only we start the Vamanopak Dravya. And if it is not starting, again we will give some medicine more. Then we continue the procedure with Vamanopaga for almost 4 to 6 liter Vamanopaga we will administer in the patient. And when the Pitta comes, we start the Lavanajala to cleanse the remaining or what is there in the abdomen of the patient. We start the Lavanjala to get the clean vomitus. And it is Ashtanga, it is written like Hina Vega. What to do if there is the Hina Vega? We have given the medicines also. but the Vegas are not coming. He says Kana Dhatri Siddhartha Lavanodakehi. With Lavanodaka, Kana, Dhatri and Siddhartha Sarshap should be administered, and the patient ask patient to do the Vamana again and again. So that is the Inhina Vega. So ideally, when we do the classical Vamana, Nirvibandham Pravartante Kapha Pitta Anilaha Kramat, it comes in this sequence only. Mana Prasadam Swasthyam Cha Avasthanam Cha Swayam Bhavet. The Vega stops by itself. This is the ideal Vamana procedure. Then assessment of Vamana. There are the 4 criteria to assess the Vamana like Vaigiki, Maniki, Antiki and Laingiki. Most important is the Laingiki Lakshanas or Laingiki assessment. But of course, for the understanding for the students, the Vega, it has written like for Hina Shuddhi 4 Vegas, for Madhyam Shuddhi 6 Vegas and Pravar Shuddhi 8 Vegas should be there. But when we see in the practical of Vamana, it doesn't come in such a way. Sometimes it comes as a Vega, like projectile vomiting, and again in some patient it comes as a Upavega. Patient will just vomit, there will not be projectile vomiting. So it is very difficult to calculate how much or how many are the Vegas. Then Maniki Shuddhi, it should be 2 Prastha, 1.5 Prastha in the Madhyama Shuddhi and 1 Prastha in the Hina Shuddhi. Of course, whatever we give, except that whatever counting or whatever liquid we give inside the patient during Vamana, after doing or after subtracting that quantity, what remains, that is the Maniki Shuddhi. Antiki, of course, when the Pitta comes, that is the proper Vamana Shuddhi. The features of Samyak Vamana is adequate expulsion of Kapha dosha followed by Pitta, sense of comfort and well-being, remission of symptoms of the disease, feeling of lightness of the body and improved body and sensory functions and natural allergies. When we get this lakshanas, we should stop the procedure. Post-emesis management is, of course, special samsarjana krama or dietary regimen is there, that is peya vilepim akrutam cha krutam yusham rasam tridvi athak ekakascha. So that is the peyadi samsarjan krama advised after Vamana. Then Shamana Upchara, medicines for particular disease or to pacify the disease, and Rasayana therapy if we are planning for the Rasayana. And here the rationality of Samsarjana, as in modern science also, the initial diet or for after gastric emptying, they have told to first start the carbohydrate, then protein, then fat. In the same way also, the Samsarjana already has been described years before or in the ancient time also. The initial diet is peya and vilepi, which is made up of rice and water, so it is carbohydrate rich and easy in digestion. Second diet is yusha, that prepared with the leguminous or dal, mudga dal mostly, which is protein rich. And third diet recommended is mamsarasa or meat juice, which is fat rich. So that is the sequential of administration of diet from lighter to heavier, and that increase the appetite in a sequential way. With this, thank you all for listening about the Vamana. Thank you.